a very emotionally fulfilling profession, and obviously we are in demand everywhere.
Hello everybody, welcome back to my channel. If you're seeing my face for the very first time, my name is Abby and this is Mary Shuttle, where we talk about study abroad and everything travel. Okay, so in today's video, if you like this type of content, don't forget to hit the subscribe button below, turn on the notification bell so you get notified whenever I put up a new video. Today we have another guest. Guys, we go through the length and breadth just to make these things work out for you. And all the way from Northern Ireland, brought in Nanelle Griselda. If you do not know Nanelle, you're not yet a nurse in practice. Okay,
Thank you for the hype.
Nanelle, it's over to you. Welcome.
Thank you so much. Thanks so much for having me. It's a privilege to be here.
Wow.
Yeah.
So humble. Oh my. Okay, so I have some quick questions for Nanelle, but before we get into those quick questions, Nanelle, can you just give us a brief intro about yourself?
Okay, so my name is Nanelle Griselda. I'm originally from Ghana. I've been in the UK since the latter part of 2018. I came as a skilled worker, as a nurse, and I've been here since then. And that inspired me to start my YouTube channel. So I'm also a YouTuber. I'm a wife and I'm a mother as well. Yeah.
First and foremost, my first question is going to be, how did you get into the UK? I know you moved in as a skilled worker, but how did you move to the UK?
So the UK is short of health professionals like nurses, doctors, etc. So the UK government has given companies or healthcare institutions the permission to employ people from outside the UK. So but then you have to do certain exams, to prove that you're qualified. And so being from a non-English speaking country, I had to write the IELTS exam. And at the time, the requirement was band 7 in each module and band 7 overall. But now I think it's at least 6.5 in writing and band 7 in the other modules. I also had to write a CBT exam, computer-based test, which is a nursing exam. I wrote these two exams in my home country, that's Ghana. And then I got an employer that gave me certificates of sponsorship. So through that, I used other documents as well. I applied for my skilled worker visa. I came to the UK. I worked as a pre-registered nurse for some weeks. And then I wrote my final exam, which is a practical exam called an OSCE. I passed that exam and then I got my license to practice as a nurse here in the UK. So basically that's the process. Yeah, you write 2 exams back in your home country, you look for an employer, and then they conduct an online interview. You pass the interview, they give you some documents so they can apply for your visa. You come here, you practice as a pre-registered nurse, and then you pass the final exam, which is a practical exam, and after that, you get your license to work as a nurse.
You moving from Ghana, did you practice in Ghana before moving to the UK?
So I practiced for a while, not so much. Let's say I did my compulsory national service for 1 year, and then I worked in a private facility for about 2 months. That was all. Aside that, the rest was just clinical and internships while I was studying as a nursing student. But the major thing I did after school was just the 1 year compulsory national service, and then just 2 months in a private facility, and then I moved here. So I didn't really practice more in the UK than I did in Ghana, actually.
So yeah, practicing a little bit in Ghana and practicing in the UK, what are the culture shocks?
In terms of healthcare, right? In terms of being a nurse.
Yes, in terms of being a nurse.
In Ghana, even if there are care homes, they are not so common. I don't think there are so many care homes in in Ghana. But here I'm currently working in a care home, which is like a facility that usually for elderly, frail, or older patients with mental health issues, or with cognitive impairments, and some people that are also recovering from a condition, but they are in the facility for a short while until they gain full, their full strength to go back home. So those are the kind of things that we do in the care home. We take care of these people, and it's not really common in Ghana. So that was a strange kind of environment for me from the very beginning. Aside the presence of care homes, also being a nurse in the UK, in Ghana, there's nothing like a register where anybody at all can go online and search. For instance, anybody watching me right now can go on the UK nursing register and then search for my name to see if I'm still registered as a nurse in the UK. There's nothing like that in Ghana. So if I get a new employer, the person can just use my PIN, my nurse PIN, or my license number and my name to confirm if I don't have any issues, like any convictions or any, problems with my PIN before they employ me. I think it puts you in check because you want to be on the register. So it puts you in check. And also the fact that there's some things that in Ghana are very, very, like, after caring for a patient, before they go home, they can give you some money in your hand to say thank you, but over here, when you do that, it's a big crime. It's a big issue. You're not supposed to accept gifts from the people you're taking care of. You're supposed to, enter into a relationship with them while you're taking care of them. But in Ghana, it's not like that. And then, the fact that over here, they are so big on their trainings. There are some trainings that you have to do every 6 months. Even though you're a nurse and you have a degree or a diploma or whatever, even if you have a master's, they will still insist that there are some particular trainings that you have to do, let's say yearly or every 6 months, just so that they are sure that you have fresh memory on that particular topic. So, like say moving and handling, first aid training, I like that because it keeps you may know it, but it keeps the things fresh in your memory, so that if you encounter such issues, like it will just click and then you can, practice what you learned. And also, the fact that you are being paid per hour. Let's say I go to work today, I'm supposed to start work at 7:45 and then close. I usually do 9 shifts, so 7:45 p.m. and then close the next day at 8 a.m. But let's say the nurse coming to take up from me is late by an hour. It's not going to be an issue because I'm going to be paid for the remaining. You understand? You work and then you get paid. In Ghana, it's usually monthly salary. Whether you were sick for 2 weeks the whole time or whatever, you still be paid the exact amount that they promised to give you at the end of the month. But here, you have to work to earn it. And then if you overwork as well, you get extra. You understand what I'm saying?
Mm-hmm.
Yeah. So those are some of the, differences. And it's nice. It's, yeah. And the fact that over here too, there are so many instruments and just so many, obviously this is one of the most influential countries in the world. So like they have everything that you need, that you read from the book. Yeah.
We read from the book. Wow. That's good.
Mm.
Okay. And now you have been a nurse in the UK for quite a while. And we all know that you have a child right now.
Yeah.
So I wanted to ask you, how did you cope for some people that are trying to come into the UK as nurses and maybe they're pregnant or they're thinking of, having a baby? How was your experience being a nurse and then being pregnant at the same time?
Okay, so when I first came, I wasn't even married, so I wasn't pregnant. I think I got married 2 years after I've been here, and then I gave birth 1 year after I was married. So it's different. If you're obviously coming with a pregnancy, I personally would say take your time, because for most hospitals and for most health facilities, they say that you're eligible for maternity leave after 1 year of working with them or after 12 months of working with them. Although some may be lenient, and then if you come with a pregnancy, they can't help you. But just to be on the safer side, I personally would advise people to give birth first and then, come over. But if they have support here, obviously they can come with their pregnancy, but they should put in mind that they may not be eligible for maternity allowance based on, the policies of that facility that they'll be working for. But aside that, because I'm in a care home, which is a private health facility, things are a bit different. So obviously when you're pregnant in the UK, they'll first of all when you tell your in charge or your director or your manager or whatever, they will put it in writing, and then they'll put it in your file, and then they'll make sure that you are assessed to make sure that whatever you are being given to do is within your capabilities, I think. I don't know the right word to use, but then they'll assess you to know that, to be sure that you're not doing anything that can put you at risk.
Yeah.
Okay. So for instance, at the time I was working in a dementia unit, so there were some residents that you could be a bit aggressive sometimes. So they told me not to go close to such residents, just so that they know that myself and my baby are safe. So there are such assessments in place. And then based on what you think you can do or what you think you cannot do. At a point in time, I told them that, day shift was too stressful, so I need to go back to night shift. And first they were okay. And then they put me on night shift because I thought the load was lighter. So they kind of pamper you when you're pregnant and you're working. Sometimes when I have a hospital appointment and they'll tell me, you can still come to work. When it's time for your hospital appointment, you can just leave and then go for your appointment. And then we'll still pay you even though you were absent for some hours. So it's really nice, yes. And the staff are nice. Even when you drop a pen, somebody wants to pick it for you because they think you're pregnant. It's lovely. Yeah, so being pregnant and working as a nurse, that's what I can say from where I was working. I don't know about the other places. Yeah.
From your experience and then what you've been through the past few years as a nurse, for people looking into nursing as a career, what's your advice for them?
It's a good, if you have love for the work, because obviously you'll be caring for people, you may have to do, for lack of a better word, let me say nasty things. Maybe you'd have to clean vomit or poo, or you see blood and see things that other people might consider nasty. If you think you have love for such things and you don't mind, fine. I think you should go ahead. It's a very emotionally fulfilling profession, and obviously we are in demand everywhere. So you're likely not to be out of a job. Yeah, it's easy to get a job in nursing, and I think it's lucrative as well. It's okay. The money is okay. You can live on that. So I think it's okay, and it's emotionally rewarding and fulfilling. Yeah, so you should go for it if you think you can. Yeah.
Okay, so guys, if you're interested in nursing, go for it. Nanelle Griselda says so, because she's a nurse and she has the experience. She's gone through it. So do well to, follow your career path and live your dreams. Okay. Now we've come to the end of today's video. Nanelle has a YouTube channel. I'm going to link her channel in the description box below so that you can follow her on that channel and find out some more tips about being a nurse in the UK. With all that being said, we have come to the end of today's video. So
thank you
bye.
so much. Bye.